Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. When most people hear the word surgery, they imagine large incisions, lengthy hospital stays, and weeks of recovery. But what if many of those same conditions could be treated through an opening no bigger than the tip of a pencil? Welcome to the incredible world of interventional radiology, a medical specialty that uses advanced imaging technology to guide tiny instruments through the body, allowing physicians to diagnose and treat disease with remarkable precision. Today, we'll step inside an interventional radiology suite to discover how medical imaging is transforming modern medicine. Interventional radiology, often called IR, is a medical specialty that uses medical imaging to guide minimally invasive procedures throughout the body. Instead of making a large incision to reach an organ or blood vessel, physicians often access the body through a tiny opening, usually only a few millimeters wide. Using live medical imaging, they carefully guide specialized tools exactly where they're needed. These procedures can diagnose disease, restore blood flow, obtain tissue samples, stop bleeding, treat certain cancers, drain infections, and much more. Because the procedures are minimally invasive, many patients experience less pain, fewer complications, shorter hospital stays, and faster recovery compared with traditional surgery. Interventional radiology is a true team effort. At the center is the interventional radiologist, a physician specially trained to perform image-guided procedures. Working alongside them is the interventional radiology technologist, an expert in operating sophisticated imaging equipment, preparing the procedure room, assisting during the procedure, and helping ensure images are obtained safely and efficiently. You may also meet registered nurses who monitor the patient's comfort, administer medications, and provide care before, during, and after the procedure. Depending on the type of procedure, additional healthcare professionals, including anesthesiologists, nurse practitioners, or other medical specialists, may also be involved. Every member of the team plays an essential role in helping the procedure run safely and smoothly. At first glance, an interventional radiology suite may look similar to an operating room, but instead of focusing on surgical instruments alone, you'll notice an impressive collection of advanced imaging technology. Large monitors display live medical images. Ceiling-mounted imaging equipment can move smoothly around the patient. Ultrasound machines, contrast injectors, specialized catheters, guidewires, and countless other tools are carefully prepared before every procedure. The room is designed to allow the healthcare team to see inside the body in real time while maintaining a sterile environment. One of the most fascinating parts of interventional radiology is that physicians can actually watch their instruments move through the body as they work. The most common imaging technology used is fluoroscopy, which produces continuous X-ray images in real time. Think of it as a live X-ray movie. For certain procedures, ultrasound helps guide needles into soft tissues or blood vessels without using ionizing radiation. Some procedures may also use CT guidance, particularly when targeting structures that are difficult to visualize using other imaging methods. The choice of imaging depends entirely on the procedure and the part of the body being treated. Before any procedure begins, patient safety comes first. Your healthcare team will review your medical history, medications, allergies, and the details of the planned procedure. Depending on the procedure, you may receive an intravenous line for fluids or medications. The treatment area is carefully cleaned, and sterile drapes are placed to help reduce the risk of infection. Many interventional radiology procedures are performed using local anesthetic, sometimes combined with medications that help patients relax while remaining comfortable. Throughout the procedure, your heart rate, blood pressure, oxygen levels, and overall well-being are continuously monitored. Perhaps the most remarkable part of interventional radiology is how physicians reach areas deep inside the body. Instead of making a large incision, they often begin with a tiny puncture, commonly into a blood vessel. Through that small opening, a flexible guide wire is carefully advanced, followed by an even smaller tube called a catheter. Using live medical imaging, these instruments can travel through the body's network of blood vessels to reach a precise destination. This combination of advanced imaging, specialized equipment, and highly trained professionals allows treatments that once required major surgery to be performed through an opening only a few millimeters wide. It's an extraordinary example of how medical imaging continues to transform patient care. To navigate safely through the body, interventional radiologists often use contrast. Contrast is a specialized substance that helps certain structures, such as blood vessels, become much more visible on imaging. As the contrast flows through the vessels, the healthcare team can watch it move in real time using fluoroscopy. This creates a detailed roadmap that guides every step of the procedure. The type of contrast used depends on the examination and the patient's medical history. Before it's administered, your healthcare team will review important information such as allergies and kidney function to help determine the safest approach. And one of the most common interventional radiology procedures is angioplasty, sometimes combined with the placement of a stent. Over time, arteries can become narrowed or blocked by plaque, reducing blood flow to important parts of the body. Using a catheter guided through the blood vessels, the physician positions a tiny balloon at the area of narrowing. The balloon is inflated to widen the vessel, and in some cases, a small metal mesh tube called a stent is placed to help keep it open. This minimally invasive approach can restore blood flow without the need for large surgical incisions. Interventional radiology can also help stop internal bleeding without open surgery. A procedure called embolization allows physicians to intentionally block specific blood vessels. Using live imaging, a catheter is guided directly to the source of the bleeding. Tiny materials, such as coils, particles, or specialized medical agents, are carefully released to reduce or stop blood flow where it's needed. Embolization can also be used to treat conditions such as uterine fibroids, certain aneurysms, and some types of tumors by reducing their blood supply. Every embolization procedure is carefully planned to target only the intended area while preserving healthy surrounding tissues whenever possible. Sometimes, imaging can show that something looks unusual, but only a laboratory examination can provide a definitive diagnosis. That's where image-guided biopsies become invaluable. Using ultrasound or CT guidance, physicians can carefully guide a biopsy needle to a specific area while avoiding nearby structures. Because imaging provides real-time guidance, the procedure can often be performed through a very small skin opening with remarkable precision. The tissue sample is then sent to a pathology laboratory where specialists examine it under a microscope to help determine exactly what is causing the abnormality. Interventional radiology can also help treat certain infections. If an abscess or abnormal fluid collection develops, physicians may use ultrasound or CT guidance to place a small drainage catheter directly into the affected area. Instead of requiring a larger surgical operation, the fluid can often be drained through a tiny skin opening. This helps relieve pressure, reduce infection, and allows the healthcare team to collect fluid samples that may help guide treatment. Interventional radiology also plays an important role in treating certain cancers. Depending on the type, size, and location of a tumor, image-guided procedures may be used to destroy cancer cells while minimizing damage to surrounding healthy tissue. Examples include treatments that use heat, cold, or other specialized techniques to target tumors, as well as procedures that deliver therapy directly through the blood vessels supplying the tumor. These minimally invasive options are not appropriate for every patient or every type of cancer, but for selected individuals, They can be an important part of a personalized treatment plan developed by a multidisciplinary healthcare team. Every movement during an interventional radiology procedure is guided by teamwork and precision. The physician relies on live imaging to navigate safely, while the interventional radiology technologist operates sophisticated imaging equipment, helps optimize image quality, and supports the procedure. At the same time, nurses continuously monitor the patient's comfort and well-being. Together, this highly skilled team performs procedures measured not in inches, but often in millimeters. It's a remarkable example of how technology, expertise, and collaboration come together to provide minimally invasive care. Many interventional radiology procedures rely on fluoroscopy, which uses X-rays to produce live images. Whenever ionizing radiation is used, safety is always a top priority. The interventional radiology team follows well-established radiation safety principles to help minimize exposure while obtaining the images needed to safely perform the procedure. Protective equipment such as lead aprons, thyroid shields, protective eyewear, and ceiling-mounted shields are commonly used. Staff also wear personal radiation monitors that help track occupational exposure over time. Every procedure is carefully planned so that the lowest practical radiation dose can be used while still achieving the clinical goal. Behind every successful interventional radiology procedure is an experienced healthcare team working together. The interventional radiology technologist continually adjusts the imaging equipment throughout the procedure, helping optimize image quality while supporting efficient radiation use. At the same time, the physician interprets the live images and carefully guides specialized instruments through the body. This constant communication allows the team to respond to changing conditions in real time and helps ensure that every movement is guided with precision. For many patients, interventional radiology procedures are less intimidating than they might expect. After arriving in the procedure room, the healthcare team explains each step and answers any remaining questions. Most patients remain awake during many IR procedures, although medications may be provided to help them relax and remain comfortable when appropriate. Throughout the procedure, the healthcare team continuously monitors breathing, heart rate, blood pressure, oxygen levels, and overall well-being. Communication remains an important part of the experience, and patients are encouraged to let the team know if they feel uncomfortable or have concerns. Once the procedure is complete, the recovery process begins. Depending on the type of treatment performed, patients may spend a period of time in a recovery area while nurses continue monitoring vital signs and the access site. Many interventional radiology procedures involve only a very small puncture in the skin, which is often covered with a simple dressing rather than a large surgical incision. Some patients return home the very same day, while others may remain in hospital for additional observation, depending on the procedure and their overall medical condition. Before leaving, patients receive instructions about activity restrictions, medications, and follow-up care. One of the biggest advantages of interventional radiology is that many treatments can be performed through a tiny skin opening rather than a large incision. For appropriately selected patients, minimally invasive procedures may offer benefits such as smaller incisions, less pain after the procedure, reduced blood loss, shorter hospital stays, and a faster return to normal activities. However, it's important to remember that every patient is different. Not every condition can be treated using interventional radiology, and your healthcare team will recommend the approach that's most appropriate for your specific situation. While interventional radiology has transformed modern medicine, it isn't the right solution for every condition. Some patients still require traditional surgery, medications, or other treatments depending on their diagnosis, anatomy, and overall health. Treatment decisions are often made by a multidisciplinary team that may include surgeons, interventional radiologists, oncologists, cardiologists, family physicians, and many other specialists. The goal is always the same: choosing the safest and most effective treatment for each individual patient. Interventional radiology continues to evolve at an incredible pace. Advances in imaging technology, artificial intelligence, robotics, and specialized medical devices are allowing physicians to perform increasingly complex procedures with greater precision than ever before. As technology continues to advance, interventional radiology is expected to play an even larger role in diagnosing disease, treating illness, and improving patient care around the world. Interventional radiology has already transformed how many diseases are diagnosed and treated, but its future is even more exciting. Researchers and clinicians continue to develop new imaging technologies, more advanced catheters, and innovative treatment techniques that allow physicians to reach areas of the body with even greater precision. Artificial intelligence is beginning to assist with image analysis and procedure planning, while new medical devices continue expanding the types of conditions that can be treated using minimally invasive techniques. As these innovations continue, interventional radiology will remain at the forefront of patient-centered care. Although the technology is impressive, interventional radiology is ultimately about people. Behind every image, every catheter, and every procedure is a team of highly trained healthcare professionals working together toward a common goal: providing safe, compassionate, and effective patient care. The imaging equipment may guide the procedure, but it's the expertise, communication, and collaboration of the healthcare team that make these remarkable treatments possible. Let's review what we've learned. Interventional radiology uses advanced medical imaging to guide minimally invasive procedures throughout the body. Instead of large surgical incisions, many procedures can be performed through tiny openings using specialized catheters, guide wires, and needles. These procedures may help diagnose disease, restore blood flow, obtain tissue samples, stop bleeding, drain infections, and deliver targeted treatments. While not every patient is a candidate for interventional radiology, it has become an essential part of modern healthcare and continues to improve the lives of millions of people around the world. If you're ever referred for an interventional radiology procedure, it's completely normal to have questions. Your healthcare team will explain why the procedure has been recommended, what to expect before, during, and after the treatment, and answer any concerns you may have. Every patient's situation is unique, and your care will be tailored specifically to your medical needs. Understanding your procedure is one of the best ways to feel more confident and prepared. From opening blocked blood vessels to treating certain cancers, draining infections, and obtaining life-changing diagnoses, interventional radiology demonstrates the incredible possibilities of modern medical imaging. It's a specialty built on innovation, precision, and teamwork, one that continues to change how medicine is practiced every day. The next time you hear the words interventional radiology, you'll know you're looking at one of the most remarkable examples of image-guided medicine in the world. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who would find it helpful. Have a topic you'd like us to cover? Let us know in the comments below. We'll see you in the next one.